All right, we'll go ahead and get started. Well, welcome to Third Thursday with GBLA. Thank you so much for joining us this afternoon. Today's presentation is going to be Understanding Medical Medleys, and what we have today is one of our current health consumer advocates, Gabriela Gomez, who's going to go over and share some important updates regarding California healthcare, including Medi-Cal covered California and Medicare. Quick few housekeeping rules. If you have any questions during any point of the presentation, please feel free to use the raise hand option or type your question into the Q&A. I will be keeping an eye on those. And with that, I'm going to go ahead and pass the reins over to Gabby to get started today.
Thank you so much, Cassie. So I'm going to go, hello everyone. Before I share my screen, again, just like Cassie mentioned, my name is Gabriela Gomez. I go by Gabby, and I am the Kern Health Consumer Center's intake and outreach coordinator for this department. And today's presentation is just going to be on healthcare updates for Medi-Cal, covered California, and Medicare. Okay, so before we get started, I can just tell you in a nutshell what this disclaimer says, and it's that I'm not an attorney. This is general information, and any information taken from this presentation does not create a attorney-client relationship whatsoever. And if you have anyone that's looking for legal help, we do recommend consulting with an attorney before taking any form of legal action. So before we get started, here's an overview of our presentation. And so what we're going to go into is the first thing is what is the Kern Health Consumer Center, who we are as advocates in this unit. We're going to go into Medi-Cal renewals and return determinations, where we are now and what it's looking like. And we'll talk about some of the things that our unit has been seeing as of lately with some of these recertifications. We'll talk about open enrollment for this upcoming year. And we also have some legislative updates to go with all of you that will have a lot of impact on a lot of the consumers that we service in regards to health. We'll also be touching on the medical expansion for this upcoming year, the asset and limit change for non-Magi Medi-Cal, and the changes that will be happening to managed care plans under Medi-Cal for this upcoming year. And we'll go ahead and close out with any questions and contact information. So who we are is the Kern Health Consumer Unit. So we're a unit here at Greater Bakersfield Legal Assistance, and we are partnered with the Health Consumer Alliance of California. And essentially, we are a bridge that helps individuals have access to healthcare, and we try to remove any barriers to access to healthcare to our consumers that call us. In addition, our unit does have our public benefits program to assist those low-income families that are needing assistance with sufficient resources and necessities of life. So how can our staff, our healthcare advocates, help any individual that comes through the doors? So under our Kern Health Consumer Center, we do help with the following items. If anyone wants to file a grievance or a complaint against a healthcare plan, maybe they were having some issues getting in touch, being able to access a specialist, or understanding what healthcare plan you qualify for. We do, if the individual qualifies for services, we do help challenging service denials if we see that there's a good cause. For example, an individual may had to go to the hospital and they couldn't reply to a letter that they received in the mail. We also help with billing or affordability problems, any surprise billing or any bills that the individual may have received that they feel hasn't run by their Medi-Cal, for example, and they feel like they have grounds to challenge it. We also help with overcoming access to services, such as if it's taking long to see a specialist, it's 3 months out and you really need to see them within the next month because you have a surgery coming up. That's something that we can also look into. For public benefits, there is an income eligibility for public benefits, and with public benefits, we do help with reductions or terminations. And then in some cases, we are able to help with overpayments to CalWORKs, CalFresh, and even help with some in-home supportive services and general assistance issues. So Medi-Cal renewals and reterminations. So as of now, they call it Medi-Cal unwinding. It's still going on. We're still seeing a lot of individuals that are getting recertification letters in the mail. The county does have 14 months to continue. And, again, this was happening because once the protections under COVID terminated, the counties had to begin doing redeterminations post all the ending of all the COVID protections. And according to an article from a recent California newsletter, more than 300,000 Californians have lost their eligibility since July 1st. Now, this can present some issues because some of the individuals that are getting terminated still are technically eligible for Medi-Cal. And there's a lot of reasons, right, why an individual might have got terminated. Maybe they moved during COVID times and their address hasn't been updated, so on and so forth. So the individual, if they receive a termination letter, they have 90 days from receiving that letter, that notice of action, to go ahead and take the necessary steps to reinstate the Medi-Cal. Otherwise, that individual will have to reapply for Medi-Cal. And those individuals, something that we're seeing that have not been income eligible, that are no longer income eligible, for Medi-Cal, they are now being referred to Covered California. And one of the challenges that we've been seeing when individuals no longer meet the income eligibility for Medi-Cal is that they're having some issues getting enrolled into Covered California because on the end of Covered California, they're showing that they're still active under Medi-Cal. And so for that, we do recommend that you reach out to your caseworker and let them know what's going on so that they can make the necessary changes to have you be able to get onto a health coverage through Covered California. Some tips that we have based on what we're seeing that may help people in the community with any Medi-Cal renewals redeterminations is keep out for those yellow envelopes. They're still sending those out. And we do highly recommend that if you can submit your paperwork, if it's 2 days, a day, 3 days before the due date, it's very crucial since right now we are hearing that the Department of Human Services is really, they have a lot going on during this time. So we do recommend that if you can submit it sooner rather than later of the due date, that way there's no lapse in coverage. We also recommend that if you submit these documents, that if you're going to go in person at the kiosk, to please request a confirmation receipt or something verifying that you have submitted the documents. Unfortunately, a lot of the times when we have individuals giving our unit a call, they say, well, I went to my social worker and I went to the kiosk, I dropped everything off. And so, when we're trying to advocate, there's no paper trail. So it helps us to be able to better advocate for the person when they have some form of receipt. We do also say to try to avoid the Dropbox because, again, we've had issues with things going missing, documents going missing. the next thing is this actually came from somebody that works at the Department of Human Services, is that do not hesitate to call and confirm that your documents have been processed, even if it's been on the Benefits Cal website. So we do have I know that, you know, from personal experience trying to help some individuals, sometimes the wait times, you know, when you call DHS have been a while, but we strongly recommend that you try to get through as best you can, just because even on Benefits Cal, when you submit documents, they're able to process them. But because, again, there's a lot of recertifications coming through, applications coming through, the timeline between it being processed and showing on your account, there might be a lapse in time. So maybe reaching out to your caseworker or your processing team is helpful. And the next point is make sure that individuals submit the correct forms that they provide for DHS. Give you an example, if you're being required to submit your CalFresh SR7, make sure you're not submitting a Medi-Cal document or something that's not related to CalFresh, because it might not even get processed. It might get terminated, and they'll say that, you know, they turned in the wrong information. The information they requested was not turned in, and so therefore happens to be a lapse in coverage or termination of benefits. We also ask to look over your documents before you submit them. A lot of individuals, they'll fill out the documents and it doesn't get processed because they didn't sign the form. And again, that just causes so much delays. Unfortunately, the consumer, the person that's trying to get their benefits, they're waiting, and it's because they just didn't sign it. So make sure that individuals that are filling out these documents, they make sure that if they have to sign the back of the form, that they do so. And you can also, this is kind of an advocacy point coming from the consumer. If, you know, the notice of action states that you've been terminated for a reason that you believe that is not true and you want to contest it, you have the ability to do so. So you, on the notice of action, in the back page, it should say that you can apply for a state hearing. And so you are capable of essentially not necessarily fighting, but, you know, contesting the notice of action and saying, you know, the grounds for which I've been terminated, they're not true. So you can call and request a state fair hearing. For this year of open enrollment, some important dates to remember is for Covered California. Right now it is open enrollment, and we have open enrollment until January 31st of the following year. For Medicare, open to both Medicare and Medicare Advantage is October 15th, and it's gonna start at October 15th, and it's scheduled to end December 7th of this year. And for Medicare Advantage plans only, so that's if you're currently enrolled in a Medicare Advantage plan, that one will run from January 1st all the way to March 31st of this upcoming year. Highly recommend that if anyone is looking to change or they're preparing to change, to make sure to do your research prior to the end dates of before the open enrollment ends, and you have an idea of what you're looking for. So for Covered California, some tips to help with when it comes to looking into Covered California, or if you no longer qualify for Medi-Cal, what you can do with Covered California. It's always good to keep in mind that the premium price is heavily affected by the value of the plan. So what this means is some individuals will get what they call FTCs, which are federal tax credits, towards their health plan that they're going to be purchasing on Covered California, and some individuals may not qualify. Just depends on household income. And so when you're looking for a plan, make sure that, just like if you're paying for car insurance, sometimes if you're paying the lower amount, it doesn't necessarily mean that you're going to have a cheaper in-house visits or specialist visits. So you really want to look and make sure that your premium price, the one that you choose, is the one that is based on your needs or what you're looking to get for for the year. Consider the total cost of care when you're shopping for the insurance. How much enrollees must you pay before you get covered? For this one, I will give you a really good example. So say, for example, I'll use myself as an example. I just have one prescription every year, and I do technically I go for my yearly routine, physical, so on and so forth. To me, something that I would consider is how much do I have to pay when I go see a doctor? It might be a little bit more expensive every month to pay an extra maybe $20 compared to me having to pay $56 every time I go see a specialist, because I may need a specialist for example, acne if I'm experiencing acne. So it's very important to really look into the premium amount and how much your out-of-pocket costs will be, and your visits to the doctor, and your prescriptions. One tool that I really recommend for people that are shopping for Uncovered California is to visit this website, and it's called the Covered California Shop and Compare tool. That tool is very helpful because you're not going to be asked to purchase the insurance or anything like that. What it will do is it will ask you for your income, it will ask you your zip code, and it will also ask you some questions about your healthcare needs. Some of those questions can be like, how many prescriptions do you typically have in a month? Another question may be, how many visits or how many times do you think you'll be going to the doctor this upcoming year? Granted, not everybody knows, right, how often they're going to be going to the doctor, but say, for example, if someone has diabetes and needs their diabetic medication, they're probably going to be seeing their primary care doctor a little bit more and needing other prescriptions. So this tool is very helpful if you kind of want to see what you would get in FTC credits and what you could potentially be paying towards coverage under Covered California. You can also call the phone number. I listed it here. Some individuals are and understandably are not comfortable with the internet. So you could always call Covered California and talk to them about any healthcare coverage. There are also community organizations that are able to help you with when it comes to enrolling. I listed some here that they're able to sit down with you and can kind of help guide you through that process. This one's really important to keep in mind. It'll come up in the presentation moving forward, but lower income individuals, they might benefit from a silver plan. And with a silver plan comes some cost sharing reductions that the state of California, currently federal dollars, but the state of California will be helping with, and you'll have a higher value without having to pay more for your insurance. And last bullet point, I always remind people during these presentations is to make sure that you are going to the actual Covered California website when you're shopping. Sometimes when you in Google, if you in the search tool, you say, oh, search for health insurance. A lot of the times brokers do pay to be one of the first ones listed, and people end up buying insurance coverage that maybe doesn't even meet their needs, or they change it and it doesn't meet the needs. So always look out for that. Tips for Medicare during the open enrollment. Even though we do recommend, even though that individuals that want to stay on their current Medicare plan, always be aware of any changes that are coming in the following year. And that may be in the form of cost, coverage, or the benefit. You will be receiving or should be receiving your annual notice of change, and it explains if there's any changes to your Medicare program that you're currently enrolled on. So it's important when you receive that letter not to just brush it aside, but to look to see if there's going to be any changes. An example would be like maybe they're not going to be covering a certain prescription and you might have to change your plan because you still need that prescription. It'll explain the coverage and costs for that following year, and make sure, again, this one's very important, that it will cover your prescriptions. If you have straight Medi-Cal, ensure you are well informed before December 7th of this year, which it's just regular. No, when you have straight Medi-Cal, you don't have an Advantage plan. And we we recommend also that if you're looking for some help and some direction on maybe, you're thinking about changing, but you don't know where to start, we recommend reaching out to the Health Insurance Counseling and Advocacy Program. They have advocates that are able to sit down with you and discuss what your needs are, and they're non-biased, so they'll help you try to figure out what the best coverage is for you for Medicare. For Medicare Advantage open enrollment, so it's a secondary enrollment period from January 1st of this year till March 31st. So during this time, only individuals that are enrolled in Medicare Advantage plans can change them. So if you hypothetically have Medicare straight Medi-Cal and you want to change it on let's say April 2nd, you're not able to because you have to have the Medicare Advantage. The plans start the first day of the following month. So say I enroll January 1st, my plan will begin February 1st. And then make sure that, again, it covers all your prescriptions before you enroll. And before you change, if you decide to change to a different Medicare Advantage plan or to switch to straight Medicare, you want to make sure that your primary care accepts that coverage, that they accept that plan. A lot of the times we do see individuals change, and when they go to their primary care doesn't accept that insurance anymore, and so they're not able to get their prescriptions, they're not able to get appointments to specialists. So it's a really big issue because people aren't getting the help that they need. And then you can go again from the Advantage plan to straight Medi-Cal if you decide to change. And always look into if you have any deductibles under your new Medicare Advantage plan. Prescription copays, this is a big one, do not count towards a deductible. With that, what that means is, so every insurance company has an amount where they say, once you reach this amount, say my deductible, right, is $1,000, I have to a certain amount of services that I get with my health plan until I reach $1,000 is when they will cover everything. So in this case, prescriptions don't count towards those one. In my case, those prescriptions wouldn't count towards my $1,000. Consider the cost of your office visits, hospital care, and specialty cares with each one of the plans. And then always make sure to educate yourself about the rules to having access to the healthcare and medications. And lastly, review if the health plan covers any additional healthcare benefits. I know one time I had some individuals that came in and we talked about, they shared with me that their Medicare Advantage plan helped pay for some groceries. So, some programs do provide some additional healthcare benefits. And again, I placed a healthcare counseling phone number here for you if you want to connect with an advocate with the HICAP program. So we're going to go into some legislative updates now. Some big three key players and changes is AB 716, which ends surprise ambulance bills for this upcoming year. Senate Bill 184, which is an amendment to Senate Bill 184, is the healthcare expansion to 26 to 49-year-olds. And the last one is the California cost sharing assistance in the budget. So recently, it was in September, it was actually signed by Governor Newsom, is the protections for consumers from surprise ambulance bills. So starting this upcoming year, consumers will protect consumers from being charged out-of-network surprise bills for emergencies and non-emergency ground ambulance service to protect people from those very expensive ambulance rates. So what necessarily would trigger, right, an ambulance bill? So it give you a good example. hypothetically say that I have some form of health insurance and I go on a ski trip in Tehachapi and something happens and I have to get transported to the nearest hospital. Let's say because I live in Bakersfield, the health insurance that contracts, right, the ambulance company that doesn't necessarily contract with the hospital that they're taking me on, they no longer can charge me the out-of-network amount. So here's what happens. So if, let's say, right, prior to January 1st, someone receives a surprise ambulance bill because they didn't know that the ambulance company wasn't contracted with their insurance company. Later, maybe a week or so later, they end up getting a surprise medical bill. And a lot of the times people don't understand where it's coming from for out-of-network ambulance charges. And it is a really big deal because if you look at these statistics, 73% of ambulance rides result in a surprise bill for those working in large companies. So a lot of individuals, more than half of individuals in California are receiving or have received these ambulance bills. And ambulances do have one of the highest billing rates in the country. So this is a really important piece of legislation because it not only protects the consumer, but it also, provides them with a more affordability towards getting ambulance help when they need transportation. So the protections that come with AB 716 is the consumer will not be given a bill beyond the in-network cost sharing amount. So again, they're going to be given the in-network cost sharing amount rate and not the out-of-network. The in-network costs paid will count towards deductibles. So again, it'll go towards the deductible amount for your healthcare provider and out-of-pocket maximums for consumers. And it protects people from being charged a bill greater than what Medi-Cal or Medicare service rates are, whichever is greater. And in addition to that, it also protects the consumer in the sense that they can, if hypothetically, right, the bill goes off to collections, the consumer does not have to pay the out-of-network cost. They're going to be given the in-network cost, not the out-of-network cost. And it also protects consumers from adverse credit reporting for the unpaid bill or being sued 12 months after their first billing. So these are just some protections that come with AB 716. All the protections, excuse me. So Senate Bill 184, this is the amendment for the healthcare expansion for individuals that are between the ages of 26 to 49 who are income eligible for Medi-Cal starting January of 2024, January 1st to be exact, regardless of immigration status. So with this expansion, the Department of Healthcare Services estimates that 707 individuals in California will actually benefit from this expansion. And according to the Department of Human Services, it is their hope that it will be a seamless transition with new aid codes. So just to give you some information on how that transition is going to look like for Medi-Cal, for those who will go from, let's say, hypothetically, only emergency Medi-Cal, will be as follows. So individuals in restricted scope Medi-Cal who fall in this aid group should have received or will receive mail notifications. So if you know of anyone that falls into this category that would benefit with this expansion, tell them to make sure that their addresses are updated, that their phone numbers are updated, and make sure that they keep an eye out for that notification that says that they are eligible. If they think they're eligible, right, they can always again reach out to the Department of Human Services if they haven't received anything and really want to get enrolled into full scope Medi-Cal. So beginning November 21st, so starting this upcoming week, they are going to start processing people that are going from emergency Medi-Cal over to full scope Medi-Cal that qualify through the automated system in batches. So they're going to start transferring people over to the full scope Medi-Cal, and then beginning December 1st, they'll be transferring those that didn't go through the batches. And excuse me, for retroactive Medi-Cal for months before the expansion, DHS will grant scope Medi-Cal based on eligibility processes before the adult expansion. So when it comes to getting your full scope Medi-Cal, 3 months before that, it's still individuals who have had restricted Medi-Cal will still have the restricted Medi-Cal coverage policies. So the same coverage that they had 3 months prior.
Yeah, but we have a question about the age group for the new expansion. Can you clarify what those ages are?
Yes. So for the healthcare expansion, we know, so it was amended originally. It was currently SB 184. It was for individuals that were 50 and over, regardless of immigration. If they qualified for Medi-Cal, they were able to enroll in full scope Medi-Cal. Now what this amendment does is the expansion is now for individuals between the ages of 26 to 49 and then those 50 above. I hope this clarified that for the individual.
Thank you.
Mm-hmm. So with the expansion, healthcare options will be mailing the choice packets for the type of healthcare managed care plan that the individual wants to fall under. But the individual, again, wants to quickly get that done, they can call healthcare options if they fall within this age group and they already know what managed care plan they want to enroll in. I will be talking a little bit about the different managed care plans in this presentation a little later, but it's good if they call or if they respond quickly to that packet. And if the individual they send out a letter and that individual does not choose a managed care plan, the managed care plan will be assigned to that individual on January 1st of this upcoming year. We recommend that people look in to see what the different type of managed care plans provide, because some of them have different, not necessarily health-related coverages, but there's a specific doctor that you want to see, for example. Maybe the one that you were looking to enroll in, they don't accept that form of health coverage. So it's always good to have individuals look more into that. Advocates and consumers must ensure that individuals who qualify for that full scope Medi-Cal from emergency or restricted Medi-Cal have their emergency and restricted Medi-Cal active during this transition. This is very crucial because a lot of the times individuals will say, I'm fine, I'm enrolled, it's active. But then when they receive a notice of action, they sent out a notice of action, but they never received it. Turns out that they were probably not active for 2 months, right? That's going to cause, if they delay and they know they qualify, but they're not active, it's only going to delay the process to get onto full scope Medi-Cal. So if the individual is currently on restricted, so-called emergency Medi-Cal, have them make sure that they're currently enrolled. That way that transition is pretty straightforward and they're not struggling later because it wasn't active. So some of the questions recently that came up and that the Department of Human Services was able to answer for us are the following. Not sure if a lot of individuals on this call, on this meeting are familiar with PRU-Call. So it's a state-specific policy for those that have Medi-Cal benefits due to their immigration status. So a lot of individuals have been asking, how is it going to affect during this transition if someone has PRU-Call? At this time, the Department of Human Services does not completely know what that's going to look like. However, you can still expect that those who qualify for Pro-Call during this transition will still have whatever full Medi-Cal benefits or benefits that they're entitled to. They'll still have them. We did hear that emergency Medi-Cal will still exist, but the capacity is still unknown during this transition. If you're an individual during this time of, because we have redeterminations happening, and then we also have, right, this expansion that's coming in this following year. If during the redeterminations, the transition of October of this year, so last month, till January of next year, if the county can't renew a Medi-Cal eligibility using ex parte review, which means the information that they currently have in their system, an individual will get an annual renewal packet for their Medi-Cal eligibility. So we please ask that you please provide the requested material that they're asking for. Again, if you can, 2 to 3 days in advance or on the actual due date to delay any issues with your application. All 90-day cure policies for the Medi-Cal redetermination notices of actions and the expansion are still in place. So it means, for example, if you receive a letter from Medi-Cal stating a notice of action specifically stating that your coverage ended because maybe you failed to submit a pay stub from last month, but you remember that you turned that pay stub in and you even have your ticket from the kiosk, well, you have, again, those 90 days to ask for a state fair hearing. We do ask the consumers update resident cards and naturalization citizen certificates if the social workers ask for that. And if you're noticed, this is a really important thing to know. If the notice of action with the breakdown of assets mentioned you qualify for Medi-Cal with a share of cost, make sure that the numbers that the county used to calculate your breakdown match your income. Because sometimes we have individuals that have walked in and the county, give you a prime example, the county knows the individual does a DoorDash and say that individual, the county thinks, oh, you're receiving $1,000 every month for DoorDash, but this individual claims, no, I only get 500. That could either have them still have Medi-Cal, but it could cause them to have a share of costs. And lately, some of those share of cost numbers have been pretty high and honestly not affordable for the consumer. So make sure that if you receive a letter from Medi-Cal that says congratulations, you know, a notice of action that says you've been approved, you just have a share of costs, make sure that those numbers on your notice of action really match what you have coming into the home. And we do recommend that if you're currently in the process of a family-based petition with the Department of Homeland Security, to please get in touch with your immigration attorney for counsel on public charge. So California cost sharing reductions. So during COVID, there were some federal subsidies for cost sharing for health insurance for covered California, but those federal dollars are set to expire January of 2025. So the state of California has actually approved a zero out of deductibles and reduced pocket costs for the silver plans for those under 250%, of the federal poverty level. So a silver plan. And we'll touch more about that in a second, but always remember that those cost sharing reductions, they come in the form of the silver plan when you're shopping on Covered California. You actually get a better coverage, sometimes even better than the tier gold when you're shopping for insurance if you get on the silver plan. So it's always good to, when you go on the shop and compare tool, to compare the different types of coverage. So just so this year, the asset limit for non-Magi programs is scheduled to end. But before I get into that a little bit, I just want to give you a timeline of how this came to be. So Assembly Bill 133, it was signed into law July 27th of 2021. And this was a two-faced bill to eliminate the asset test for those that used to determine for those that are on non-modified adjusted gross income, which is non-Magi, Medi-Cal programs. So that includes long-term care and the Medicare savings program. So in July of 2022, they did increase that limit to $130,000 per individual in assets and $65,000 or more for any additional member up to 10 individuals. So what this did is it expanded, this actually allowed more of the population to be able to have more of those non-exempt assets and still be eligible for Medi-Cal. Moving into phase two, so the FCM has approved the state plan to eliminate that asset test, and that passed July 14th of this year. So starting January 1st, there will no longer be an asset test for all non-Magi programs, including long-term care and Medi-Cal savings program. So if you know of any individuals that because of the amount of assets that they had, they exceeded 130,000 and they were not able to apply for have Medi-Cal, they may be able to now that starting January 1st, they will be eliminated this year. So I did say we were going to touch a little bit about managed care plans. So under Medi-Cal, starting in January, HealthNet will no longer be a managed care plan starting July 1st, 2024. So if you know of any individuals that currently have Medi-Cal and they have HealthNet, that transition will definitely happening at the moment, will end in December. So consumers can choose so there's going to be Kaiser through Kern Family Healthcare. Blue Cross, Anthem Blue Cross is going to be coming in starting January 1st as an option. And Kern Family Healthcare will continue to be a managed care plan under Medi-Cal. So these are the choices for people getting onto Medi-Cal. So some tips when individuals are selecting a managed care plan. First thing you should always think about is what is important for your healthcare needs. Everybody's healthcare needs are going to be different. Some need more prescriptions than others. Some need more specialty care than others. So it's important to make sure that you're getting the best coverage under that managed care plan for your needs. It's always good to talk to friends, family, and your doctor about, what specifically you're looking into. I know I had a doctor at one point and my aunt was looking for new primary care. So I told her that I liked going to my current primary care doctor. So it's always good to talk to people and see what other options you have. There are providers on directory pages when you receive your care packet. Please keep those with you. It's always good to look to see if your doctor is listed to make sure that, if you're going to you have a referral for specialty care, that you can go to a facility that takes your managed care plan. Again, check to see if your doctor accepts the managed care plan you're looking for. Another big one is evaluate the wait times with your current provider. Sometimes there's individuals that wait 3 hours to see a provider, and it may not be, you may not have those 3 hours. You maybe go and you need to get treatment faster. So always take that into consideration. The other thing to look for is to see if the doctor that you're going to be either referred to or will be your primary care has experience with your type of medical problem. Always think, am I comfortable with my doctor? Do I feel comfortable going to this individual? And always familiarize yourself with the plan you select. And each of these plans, the managed care plans, do have a phone number for their members that you can contact. So if you ever have any questions or need to reach out to that managed care plan, you can. And I put this, this is actually, I put this hyperlink here. You are actually can go onto the healthcare options page and actually there's a tool there where you can actually compare the 3 managed care plans based on the providers that they have, on the services they provide, and it'll give you a little bit more insight so you have you're better able to choose whichever managed care plan you feel like would be the best option for you. So that's pretty much it for the presentation. Thank you so much for your time. Just before I get into any questions individuals may have, we have our main line here and our current health. So our department, the Current Health Consumer Center unit, we have our direct intake line. That the phone number is listed there. We just kind of let everyone know we're opening new cases starting November the 20th. So if you feel like our unit may be able to help you with a specific matter, give us a call starting next week. And our Fair Housing Law Project phone number, they also have a direct line, intake line as well. And don't forget to connect with us.
Thank you so much, Gabby, for that information. Let me go ahead and run through and see if we have any questions. We are asking for copies of the slides. That is an anonymous attendee that asked that question. Please go ahead and reach out to me directly at the email that was provided when you registered, kmullican@gbla.org, and we can make it available. Also, do note this presentation was recorded and we posted to our YouTube channel tomorrow, so you'll be able to access this for more information, at least for the next year. Do we have any other questions? And let me just do a scan through. I do have a question raised. And then let me see here. I do see your hand raised one, but I'm not sure if it gives me access to unmute. But based on the way that we have the program set up, is it possible for you to type that into the Q&A box? And I will work on that option to unmute our attendees in the future for questions. Okay, he said he's good. Okay. All right. Well, I don't see any other hands raised at this time, nor do I see anything in the Q&A. I'd like to thank you for joining us for Third Thursday with GBLA. Gabby, thank you so much for sharing this valuable information. As I mentioned, this presentation was recorded, will be posted to our YouTube channel. We do frequently share information on our social media pages as well. And then feel free to reach out to me anytime if you would like more information about any of our past webinars, or if you have any ideas for content you would like to see in future webinars. With that, I'm going to go ahead and say good evening. Thank you for joining us.